Hello, hello. Good morning, everyone. Or is it, sorry, good afternoon, everyone. And thanks so much for joining us. Let's take 5 minutes. Let more people join us. Um, we'll begin momentarily. And you're welcome once more. Dr. Anuya, you're welcome. Uh-oh, can't hear you. Are you muted? Are you? Uh-oh, can't hear you at all, Dr. Anuya. Funda, you can hear me, right?
Yeah, I can
Funda,
hear you. I think it's her network.
okay.
She should
I
try
think
and
it's your
change.
network. Yeah. Yeah.
She's in earpiece.
No, what? No, no, no. She's not in the office. No. Uh-oh. Okay, now you're muted. I see you're mute. Could you unmute? Can you try to speak now? Uh-oh. Can't hear you still. Can you get off the call and come back in? Yeah, yeah. I think that would be better. Okay, so let's try to get over that technical hump. Uh-oh, can't hear you. Can't hear you. Can't hear you. Uh-oh.
Oh,
And
can she? Can you hear her? I can't hear her.
I can't hear her either.
If she tried doing it with her phone, this maybe it's her laptop that has the
Yeah,
issue.
yeah. Maybe your laptop might be being problematic. Yeah. So I guess we'll. Well, thanks so much for being on time, everyone. And if you know anyone that plans to be on this call, please do let them know that we're about to start. My name is Sarah Abiola. I am going to be the moderator for this conversation. I'll go into a little bit more about me when we begin properly.
Okay, is it better now?
Oh, perfect. Perfect.
Yes,
Perfect.
yes.
Yes.
Yeah, I just
Yes.
restarted my computer, so I'm glad it worked.
I'm glad it worked too. Um, okay. I had hoped to, because we have like 100 and over 100 people register for the webinar, and I was hoping to give them a chance to join because
Okay.
there's relatively few people on the call. Let's see here. Yeah, only 17 people have joined us. I wanted us to hit at least 20 before I started, given the sheer number of people that had signed up.
Okay.
So I don't know. I also don't want to punish people that came early. So let's give it a couple more minutes, and let's see here. Okay, we have 18. Once we hit 20, I think we've hit a quorum and we can begin. I'm gonna let it be. I just don't want us to begin too early, but let's see. What time is it over there, Dr. Anuya?
This is past 5.
Oh my goodness, early start. Thank you so much for joining us, though. Okay, we've hit 19. Um, mm, yeah, let's go ahead and begin. Actually, I don't want to penalize the early comers. I believe we're 4 minutes in. Okay, let it be 30 more seconds. Once we hit 5 minutes past, um, 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 let's see. Okay. All right. Once it's 5 minutes in, then I'll begin. We're pretty much almost there. All right. All right. So thank you so much for joining us, everyone. My name is Saratu Abiola. I am a program associate at Corona Management Systems and also the team lead at Sauki.ai, which is a tool for science communication, specifically to help people, to help pretty much everyone, whatever your level of expertise, to generate easy to understand briefs from technical public health research. I'm just going to show you what Sauki looks like. So let me just share my screen really quickly, and I'll just show you what it looks like, and then we begin on the webinar. Let me see. Kunle, I'm not able to. Okay, I got it. Okay, so share screen. I'm going to just share my screen with you really quickly. All right. Can you see my screen? Perfect. So essentially, Sauki turns complex papers to simple briefs. Three very easy steps. Essentially, all you need to do is upload your paper, select your brief, and you can see you can select different briefs from different levels of complexity. Academic briefs for really technical people. If you're a layperson, you can generate a general public brief or a decision maker brief, also very simple. And donor briefs are also a little technical. So you have your ability to generate any kind of brief you want. And of course, you can generate multiple briefs per paper. And once you generate it, that's it. You just kind of hit generate and then you move. So when you're ready, hopefully, you can give it a spin yourself. And then you hit simplify and then we get going. So that's basically what Sauki looks like. And I hope you test it out. All right. Now to the subject of our webinar. So you're welcome once more. This Uh-oh. Uh-huh. So this webinar is one in which we're pretty much talking about creating systems, ecosystems for AI in public health. And the reason why that's important, why I thought it'll be a really great topic for us to engage on with regards public health. is that there's all this talk about AI, and healthcare systems in Nigeria, but also across Africa, have major systematic issues that need to be addressed. And one of the things with technology is that technology has the ability to address systematic issues at scale if used correctly, right? And I thought that it'll be a really great opportunity to kind of think about, okay, everybody keeps hearing about all these buzzwords, but what is AI really beyond the whole ChatGPT stuff? What is AI, and how can we, those of us who work in public health, who are interested in public health and healthcare systems, use AI? So I, enlisted Dr. Ogenemaru Anuya, who is an expert and an AI researcher, to have a conversation with us and to tell us a little bit more about the subject. So that's why we're having this conversation. So I'm gonna ask the first question. So I guess, Dr. Anuya, you've been doing a lot of research, and I noticed that you're doing a lot of research on human-computer interaction and AI. I know that it's my opinion that all the work that we do, especially people like you that are researchers, you're always looking to answer certain questions with your work. Could you talk a little bit about the work that you've done over the past decade or so, and what questions you're looking to answer now in your work?
Okay. Yes, thank you very much for that question, Saratu. So I would start by just defining what the field of HCI is. So HCI, or human-computer interaction, is fundamentally about how people engage with technology and how we can design it to better support their lives. And when we mean people interacting with technology, is not just about making the interface usable, right? It's also about asking deep questions when it comes to humans and technology. Questions like, what technologies should we design? Whose needs are being met or ignored by these designs? It's also about asking questions like, how do we ensure that technology is serving people, rather than them having to constantly adapt to technology, have to learn or struggle using the technology itself. So now my focus right now, especially in the age of AI, as AI has become more integrated into our daily life, is to explore questions like, how do humans interact with these AI systems? How do we collaborate with AI systems? What makes these engagements empowering, trustworthy, and meaningful? Also, I ask questions around how we can design AI-powered tools that can support people in ways that align with their cultural, social, and contextual realities, rather than imposing external solutions on them. And another really important question that resonates with me is, what are the unintended harms that AI technologies might introduce to them, and how can we identify those early in the design process when designing for them? So for me, I'm a firm believer. I believe strongly in this potential of technology to support people and communities, and that's what really drives my work. So yeah, so that's just those are some of the questions and things that I've been seeking to answer in my work currently. Oh, you're muted.
Yes. Oh, that's thank you. Thanks so much for answering that. And that's all really interesting. And a lot of us in Nigeria, particularly, when we're building Salki, I had the opportunity to talk to a lot of public health related people, whether they were in the government and the administration, or they were building solutions, or they were journalists, and everybody kind of stops at ChatGPT. They just very, very okay, Claude, ChatGPT, maybe DeepSeek. But I was hoping that we could talk a little bit more about AI systems and kind of zoom out from the ChatGPT that casual users are aware of, and to zoom out a little bit and talk about AI and how we can boost efficiency and productivity in public health. Can you, from the work that you've done on health systems, can you talk a little bit about the possibility, especially with an eye to countries like Nigeria or Kenya, African countries?
Okay. That's a great question. So absolutely, many people primarily think about like just AI and ChatGPT. We've seen a lot of like you see a lot of things online and you hear a lot of like conversations. People are using ChatGPT, they write a prompt and then they get responses, whether like images or like text responses. And people say, oh yeah, this is AI and all that. But like there is a lot more when it comes to AI, and the potential is really broad across different domains, right? So let's think about like in terms of like mental health. Like you see, AI chatbots have the potential to simplify complex information, complex like psychiatric information for them, so that like lay users can better understand them and like in order like provide them with understandable explanations for like their mental health diagnosis. So like AI is really changing lives like in that way. Also also in terms of like education, like there are so many opportunities around like AI in education as well. We've seen like recent studies that have shown how like AI supports like children in the classroom with complex skills in safe environments. For example, I read a recent paper that talked about like AI in cyberbullying education and how teachers like use AI-powered chatbots to let students like practice like upstanding behaviors. So in this way, like children could rehearse how to stand up to bullies, online bullies, like for instance, learning what to say to support someone being bullied or how to diffuse a situation. This is one example. Another really interesting example is how like AI is used in the classroom, like to support like learning some particular subjects. Like let's talk about one recent study about like learning about history, right? So they used it was an integration of like virtual reality with AI agents. Like imagine wearing headsets and you're learning about like African literature from like Chinua Achebe, like right.
Mhm.
You're seeing this
Mhm.
a popular figure teach you this, like you're learning along the way, right? Like so they integrated that and like to see how agents could perform like actions like pointing, sword dancing, or writing, right? So that's another
Sorry, and
example.
AI agents are. Can you just talk a little bit about what are AI agents?
AI agents are just like AI just trained to perform a particular task. Let's say to teach you something or like to it's just like you're having a personal assistant that does a
Mhm,
particular task. So that's like AI agent. Like like
mhm,
with ChatGPT, you interact with it, you ask it question, it provides you with numerous like and like it has a wealth of knowledge. But like for AI agents, they are like specialized on a particular problem
mm, mm,
to
mm,
help
mm,
like
mm,
to help the user in that way.
mm, mm,
Yeah.
mm, mm.
So yeah, so there are numerous opportunities, right? And even thinking about in large corporations, people are now like AI is now integrated into so many products that people use to work, right? Like to improve productivity, to make their work more efficient. And then another interesting area is in public health, right?
Mhm.
Like studies have shown how AI chatbots can help public health agencies to reach more people, right? Like especially when there are not enough like frontline workers to do regular phone calls. Like AI can really like help facilitate that, to improve that. And we have another like use case around like information access. One is a recent study that showed how AI can support community health workers by giving them like quick and private access to health information, so that like they might like feel shy or like feel worried to ask their supervisors, right? Like they can chat with this chatbot, and it provides them with information that to help them better do their work. So like there are just so many opportunities for using AI and technologies like large language models beyond just ChatGPT.
100%,
In essence,
100%.
yeah.
And what I'm hearing is that there's a lot of opportunities with regards last mile service delivery, particularly with regards like reaching people with information. It's actually one of the reasons why we did Sauki, because Sauki is also very much concerned with taking, a lot of people, to kind of make public health information easier to understand for people. So in a very similar way, kind of taking, helping people understand public health information better. But then also, like you mentioned, helping health workers themselves as well. I also read that some people are even using AI for diagnostics and like for taking health information and spotting trends.
Yes, absolutely. Yes. That's one thing that like AI is really good at, like analyzing like large volumes of information, and then like determining like trends, and then like when a new patient, like when you have like a new patient case, like based on like trends that it's learned from like other patterns, right? Like it can be able to like answer the person's need, like based on that. So like it's very good at that, like identifying patterns. Like you can use like such these tools, AI technologies. Yeah.
Exactly. So I guess my next question is, obviously we have researchers, we have healthcare systems, we have obvious efficiency gaps in different healthcare systems in not just in Nigeria, but across African countries. Can you think of the ways in which people are integrating AI into the workflow? Basically, and this is like, let's even zoom out beyond Nigeria. I'm sure you must have seen, adoption of AI in public health systems in many countries. Can you talk a little bit about what it took to, say, hey, this AI, it's helping us to spot patterns and to it's supporting analysis of large sets of data for us to be able to spot trends and improve diagnostics at a scale that we maybe as human beings would take us a little bit longer. And okay, so we're going to start using that. Can you talk a little bit about how people have integrated AI into their health system, from examples that you've seen? What were some of the things that what have been some of the opportunities that you've seen people take advantage of within systems, like across systems, and really fully integrating AI?
Okay. Yes, that's a very important question. Thank you for that. So, when we think about health systems, right, like as a whole, um, AI doesn't come in as a replacement for people or systems. It comes in as a tool that can bridge existing efficiency gaps and enhance their work, the human works. So like from recent research, we've seen like when it comes to researchers, AI can help like analyze large volumes of like health data and quickly find patterns or insights that would take humans weeks or even months to process, right? Like you see this is the algorithm that can go through this and like provide answers like very quickly. So in this case, like it can AI for researchers, AI can speed up discovery, right? Like whether in public health trends, patient needs, or in terms of like designing targeted interventions for them. So that's like how AI like can help support like researchers. And then when it comes to healthcare systems, AI can support service delivery. And I'll tell you how, like, for instance, like in the studies that we've seen, chatbots can help like handle routine check-ins with patients, right? Like you can like follow up with patients. It can help like free up frontline staff to focus more on complex care needs, right? Like it can, in the studies like we read, like AI chatbots helped reach more patients when human resources were limited. But they also like created new tasks like follow-ups, that so it's not like a very simple
Mm, mm, mm,
replacement here.
mm.
And then
So,
when it comes to, yeah.
sorry, just a quick one. So, is it that the hospitals, the healthcare system, like, leaders were like, hey, we're going to start building these chatbots so that it would help, this particular, kind of service delivery, and that they built these chatbots to do that?
Yes,
Or
they
is it
use chat.
individual hospitals that are doing that? Or is it like, healthcare systems leaders are going, hey, I think as a healthcare system, we should integrate it in this very specific way.
Yeah, so thanks for that question. So this is like research. So this was like in collaboration with like a community,
Mm-mm-mm.
in collaboration with like a community healthcare system, and then like
Mm.
they designed, they researched with them and they designed chatbots, a chatbot that
Oh.
can help them for that particular need. But like
Mm.
yeah, there are opportunities to collaborate with like hospitals or like agencies, like people, like in order to like help improve how they work. There are
Mhm.
numerous opportunities for doing that. Yeah.
Indeed, indeed. Just
Yeah.
a quick hello to everyone that's joined us since we began. I see that we've grown in number a little bit. You're all very welcome. I'm seeing some of you adding your name and contact information to the chat. Thank you so much for joining us. And I hope I'm seeing people from Kano, from Jos, all over Nigeria, Abuja. Please, I'm hoping that this webinar is informative for you all, and that you ask questions when the time comes. I'm going to open up for questions quite soon. All right, so Dr. Anuya, um,
Yeah.
so
Yeah.
obviously not everything is an AI problem. So how do we know what's an AI problem and what isn't?
Yeah. That's a great question because like I feel like every time I go online, I see everything AI,
Everybody
AI.
wants
There's
AI.
yeah,
Everybody's
everybody wants to
throwing, ah, but it can't be. I mean, not everything is an AI problem, right?
Yes, and that yes, that is correct. And it is a very important point because like just because we can use AI doesn't mean we should use AI for
Every
everything.
single thing, yeah.
Yeah. And for me, one way to think about this is to ask two quick checks. So first, is the problem about like handling large amounts of like repetitive information, like something that has to do with patterns or like providing consistent like responses to something. Like if you're dealing with like large volumes of data, like something that would have to do with like repetition, right? Then that is what like AI can shine in doing like for that. Like that's where AI is good at. Like for example, analyzing like thousands or like millions of like health records or giving the same basic information to lots of patients or people. Like that's where like you can see like AI shines. But like another quick check you can do is, does this problem need human judgment or does it need empathy or moral decisions? Then those things AI cannot be good at it on its own. Even if you're going to do that, like you need a human being in the loop. Like for
Exactly.
example, yeah. So for example, in the papers that I mentioned, like they like AI chatbots could check in with patients or like students, but privacy concerns, cultural trust, or emotional support still needed human oversight. Like
Indeed.
we still need the human in the loop. We can't just um, like something that I would say like is unethical. Like imagine that you are working with vulnerable populations, right? Like and you are designing this. Imagine that you're going to use like a system powered by the algorithm that powers like ChatGPT, like GPT-4, and you want to use, you're designing a system that can like determine if a person should receive a service or not. Like you have someone come in and the person is like, oh yeah, these are all the challenges I have. And then you want to use the algorithm to determine, oh, should this person receive the service or not? That is not ethical. Because there are so many underlying things that go into a person's story, a person's situation. You can't like leave that to an algorithm to determine for like yes or no. Like so things like that. Like we need humans, like we are emotional people. We are incredibly smart, right? Like we are smarter than AI, we are smarter than all these algorithms. Like we need human oversight for things like that. So
100%.
those are things that we should definitely not leave
Yeah, to
the
AI
decision
systems.
to AI. So like
So would
again,
it
so
be
yeah.
so would it be correct to say your analysis when it comes to helping to generate to identify trends and analysis, definitely use AI to support, but the recommendation that comes after the analysis should be human. And
Yeah,
when you're
it- yeah. We need a human being in the loop for that. Yeah,
exactly.
yeah.
But then if it's something that's repetitive, like for example, if A, B, and C usually means that okay, if we're able to put in this particular diagnosis requires this step, that step, this step, that step, and you need to communicate to the patient, then you can use an AI system to say, okay, this is what the treatment plan is, and kind of doing reminders, for example, to customers, for example. That's something you can use AI for because it's regimented and it's not analysis and it's not, but then it's something that's already like ABC, leads to DEF. So you then automate that.
Yeah, you can use it to automate that process. Yeah, and even
Exactly.
one example, we have examples of like I've seen examples of like using AI to analyze like X-ray data. Like it's trained. So imagine like you have an algorithm that is trained with like millions of like X-ray images, and then like it has its predictions, and you can use the system to like identify like giving a new image, like does it have like this disease, like things like that. So it can analyze trends. But like when it comes to like moral decisions, like some ethical decisions, then we need the human like for that. We cannot leave that totally to like an AI system. So
Exactly.
that's yeah.
Exactly.
Yeah. Yeah.
Um,
Um yeah,
yes,
so
please go ahead.
so just a good rule that I would suggest is like, AI works best when it augments human work.
Exactly.
Like in terms of like taking over tasks that are routine or data heavy so that people can focus on what humans do best, which is making sense of context, showing care, and like making ethical choices. But if it's purely
Indeed.
about human relationships, deep cultural meaning or values, that we like, that's usually not an AI problem.
It's usually not an AI problem. That's a very, very good guidance that I hope we all take heed on. And that actually reminds me of the fact that when we were building Salki, one of the things that we wanted to do was to make sure that the tool, yes, Salki would help you to generate simple briefs for different modeling research, but we wanted to make sure that there was absolute fidelity to the paper, so that when you're engaging with what is coming from Salki, you can trust that there's no analysis. But in the process of building a tool that would stick to what the paper said was actually a process, and making sure that we were not creating something that, for example, what if the tool hallucinates and is giving you faulty analysis, and like this is what you should do as a result of this research. It could lead for faulty information, and people basing their assumptions on faulty information or faulty misrepresentations of data. So we thought that it was something that we did that we did the best that we could anyway, to make sure that the tool didn't do, because we also were very wary of, okay, how do we ensure that we're building something that we're considering cultural relevance, we're considering bias and things like that. So even when you're building AI systems, you also absolutely have to consider all of that. So whether you're building the systems or you're using the systems, you have to be very wary of the extent to which you're taking its outputs wholesale.
Yeah, great point.
Yeah, my next question for you, I came across a research that you did, systematic review of AI systems in the global south, and it really goes really well with something you just talked about in terms of cultural considerations. What were some of the things that you learned, like that makes it difficult, for example, or that people that are from the global south, these tools were made by people like, OpenAI, all these other, Google, these are Western companies. We're in the global south. When you're using AI tools that were not built for your environment, what are some of the things that you noticed in your research that made you conclude, yeah, let us be very wary of cultural differences when we're engaging these kinds of Western created tools?
Yes. So thank you for that question, and I'm glad that you brought that paper up. So I was like, just for some context for people that are on this call that are not familiar with that paper, I'll talk about like what motivated that work. So what really motivated that work was noticing that AI systems are like being developed rapidly worldwide, but like often often without considering like cultural context of like users in the global south, like regions like so the global south include like regions like Africa, some parts in Asia, Latin America, Oceania, like there's some like countries that fall under the global south. And so we noticed that like with the prevalence of AI, they're like it's not always developed into a Western with it's mostly developed with this Western centric and perspective. We've seen like instances of like people like for instance like wearing like a hijab, like they are trying to use like facial recognition systems and it doesn't work for them. Like to them, like wearing those headscarves, that's a cultural symbol for them, but like it doesn't like they can't use like they can use these like popular AI facial recognition systems, or like how many times have we tried to use let's say you're trying to use like a a voice assistant, like you're trying to talk to it, like it's struggling to recognize
That's
your accent. Yeah, yeah, exactly. It's trying to like transcribe like what you're saying because of like your accent. And even like popular tools, you see many AI systems like, but there are many languages. Many people like for people, languages are like their cultural symbol. But like, most of these mainstream AI tools, they are not like they haven't adapted well to like multiple language, like different languages, just like common languages that they can interpret, right? So
Exactly.
most of these tools are designed with from a Western centric perspective. So given this motivation, like we wanted to know like how well cultural considerations are being integrated into AI systems for these regions, like for regions in the global south. And when we did the systematic review, we found like several key insights that I can like talk about briefly. So first, like I mentioned, there is a strong Western-centric focus in AI design. Many tools do not account for local languages, dialects, or cultural norms, which limits their usefulness in regions in the global south. Another second thing that came out from this thematic review was that there were like significant challenges such as like low technology literacy among users in the global south, which affects how people interact with AI tools. You cannot interact with a tool if you don't know how to. You can't use it if you don't know like you can't interact with it like if you don't know how to use these AI powered tools. We also found that there are limited availability of local data sets. We cannot build like culturally sensitive AI systems if there are no data sets available. What what makes an AI system is the data availability of data sets. Like we need data sets. So that was one other problem that
That's
we
an interesting
identified from this
data
work.
structuring thing. For example, our own ethnicities are not, represented in America, for example, or in France, or, religious consideration, local government, those kinds of things that if we're, when you're structuring, the way we structure our data is related to things that matter to us that may not matter over there.
Yeah, no structure, like even being available at all, like yeah, even the availability itself. Like, do you have like data sets that are available, like in like data set that you can use to train, like let's say a particular language, like if you want to interact with a particular, like, using a particular, like you come from a particular community, right? Like data sets from uh language data sets from
Mm-hmm,
like the
mm-hmm.
global south. These are not like readily available, right? So it makes it hard to build AI models that understand local context if we don't have readily available data sets. Another problem that came up was around like lack of transparency and explainability, meaning that people often don't trust these AI models because they don't understand the decisions that are being made. So that's another like
Mm,
really, really important thing. Like we have to think
mm. It's
about
very
like
much a
AI.
black box. Yeah.
Exactly, right? Like we have to think about AI explainability. And then third, another important point I wanted to mention here about that paper was um a concerning finding about like who is doing research, right? So we found limited representation of African, like researchers from the global south, like especially like
Mm,
researchers from Africa that are like solving our problems, like
mm.
solving local problems. Like
Yeah.
there were many projects that were led by researchers in like in the West researching African problems. Like this, if we have that, like we can suffer from something called parachute research, where like parachute solution, where like people design something, they research and design something that cannot work for your local context because like
Mm-hmm, mm-hmm, mm-hmm.
um we need that local context. So those are some of the things that emerge from that work. So we really need more researchers, we need more data sets, we need more of us like researching our local problems, addressing these systems. We need more AI based systems that are oriented to our needs in the global south. So those are some of the key
100%.
points that came out from that paper. Yeah.
That's really great. And just another welcome to everyone. I'm so glad you said quite interesting and insightful. I agree. Thank you so much for joining us, and thank you to all the 41 people that are here. I'm glad the numbers grew. I hope you also are finding this conversation interesting and insightful. I'm about to open it up for questions, so please be ready with questions. When I'm done, I'm going to ask the final question, and Dr. Anuya will graciously respond, and I will open things up for questions. So get ready with your questions. Feel free to put the questions in the meeting chat or raise up your hand and speak, whichever works for you. So okay, my final question to you, before we open things up a little bit, and maybe I'll, for the benefit of people that came, I'll talk a little bit about Saki before I open it up as well. Um, what are some, okay, so I think this is actually a really good final question given your response just now. So what are some of the, there have been some people in the global south, in Africa and in some, poorer Asian countries that are beginning to build small, LLMs and, small AI systems. And I was just wondering what some of your favorite examples are, how different African countries, of how people are engaging with it in different African countries, and what opportunities you want to see, taken advantage of a little bit more with AI in Africa specifically.
Yeah, thank you for that question. Yeah, so when we consider AI use in like low and middle income countries, AI use in the global south, like particularly like I'll talk about like Africa, right? There are several notable examples that stand out for me, and like in different domains. I'll start with like in terms of agriculture, because agriculture is just so important to us as Africans.
100%, 100%.
Yeah. So in Kenya, there is this very popular like tool. Like we have AI tools like Plants Villas, like Nuru app, that uses image recognition to diagnose crop diseases for cassava, like especially. So in this case, like how people use it, like farmers like will just like take a picture of like take a photo of like a plant with a disease, and then the AI model, which is trained on like thousands of like annotated images, we identify the disease with accuracy comparable to like a real like a farmer, a specialist themselves. And then yeah, and like also thinking about this is very, very important, because we know how in East Africa, for instance, like this is it costs millions annually, like yeah, agriculture. So it's really important, like this is really changing agriculture for them. And then we have in Malawi, there is a pilot generative AI app that they use that provides like farming advice to farmers, like including like about like fertilizer recommendations and pest management, that helps them like address like information gaps and language barriers in rural areas in Malawi. And then moving on to healthcare, like there are several like solutions, like even think about like what you're doing for Sauki AI, like trying to improve information access. And then we're thinking about like another example is in Rwanda, like where AI, they integrated AI in their zipline drone logistics, like where it enables like rapid delivery of like vaccines to remote health facilities. In Nigeria, there's a popular like AI facility, like where AI is being used to used for like cervical cancer screening, where like it can analyze like cervical images to determine to detect signs of like cancer, which is like really vital before like seeing specialist doctors. And then we have examples like in education, we have examples in social protection. There are so many like that. So these are some of the examples that have really stood out to me. And then and there's also the question of like how different African countries are actually engaging with AI right now. I'm really excited to see several countries come up with like AI strategies. Like we have governments that are coming up with like national AI strategies. Even like Nigeria, Kenya, Rwanda, they're developing like national AI strategies in order to like guide how we can design AI responsibly for the citizens. We are seeing a wave of like startups come up with like locally relevant solutions in sectors like agriculture, healthcare, financial services. There are many startups coming up on a daily basis. So there are just so many examples these days about like how AI is being used in regions in the global south. So yeah, I'll really, there are several opportunities. There are several opportunities. I want to still like, I want to see AI being used increasingly to predict disease outbreaks, natural language processing, also like to improve information access. I really appreciate the work that like your team is doing, where like you know trying to simplify academic research for people, for policymakers, so that they can like, so people can be able to like easily digest and like know like the next steps to do, like immediately how to respond to what's going on. So like these are some of the examples that really stand out for me.
Indeed. Thank you so much. And there's and to think that what you've said is only just a few potential uses that could be, there are so many opportunities, and I think that it's something that I'm hoping triggers some creativity among us to think a little bit about what what we can do with technology and what, think about the problems we have and what problems we can solve with technology.
Yeah.
Ania Falk Akpasa just said, from the discussion so far, I understand AI can be deployed in mathematical modeling for public health in interventions like malaria, using targeting combinations of interventions, historical data surveys, and for best results. There's certainly lots of ways that modelers can use AI. I was just at the AMNET meeting, which is God, the malaria modeling. It's a malaria modeling network, malaria modelers network, um, and they just had their meeting in Dakar, and there was a whole section on the use of AI, and both the possibilities and the limits, both in terms of helping modelers be trained. Obviously, you need to have a baseline understanding of modeling before you can then use it. You can't just use AI for modeling. You have to actually have expertise and use it for different aspects. Maybe for because modelers are using tools like Python or R, to develop their tools. Maybe AI might be able to help people with, for example, in improving their syntax when trying to get certain kinds of outcomes. And it could help make it easier to use the various tools that modelers would use for their analysis. Of course, the actual modeling skill is not something that I would suggest anybody just kind of uses. Okay,
Mhm.
I'm just going to use AI to model something. I would do not recommend that. In
Mhm.
fact, for any kind of coding or programming whatsoever, I do not suggest using AI to build anything. You need to, unfortunately, there's no replacement for the actual building of knowledge. You have to start there. AI can help you with syntax, can kind of help you figure out, okay, if you're stuck on the code to use for this or that, that's wonderful. You can use that.
Mhm.
But please don't try to use AI if you're not already a modeler, because if AI gives you, because AI can be wrong. So if AI tells you what to do, and it gives you wrong information or at least misleading information given the lack of context, if you're not already a modeler, you struggle
Mhm.
to detect those things. So it's very important to understand the potential but also understand the limits. So yes, for sure, definitely explore ways to use mathematical modeling for public health interventions and for different combinations of things, but also be very aware of the limits. And that's why in this conversation we're trying really hard to, yes, it's wonderful to use AI, but also understand its risks and some of the dangers so that you can use it, you can deploy it well, essentially. All
Exactly.
right. So I'm gonna open up for questions but I just noticed as that some people came a little late. So I was just gonna introduce myself once more. My name is Saratu Abiola. I'm a program associate at Corona Management Systems. And I'm also the team lead for Salki.ai, which is a tool that seeks to help people to generate easy to understand briefs, um, from public health modeling research, from public health papers. You can use it for modeling papers. We built it for modeling public health modeling research, but you can actually use it for pretty much any public health research. And it's very easy to use. You just upload your paper, you select your brief. You can make briefs that are really complex or really simple. You can make academic briefs, or you can also make general public briefs. You can make pretty much any kind of brief you want, and then you generate. So I would suggest definitely give you click here and it lets you give it a test run. So
Hmm.
Sorry, it looks like she had a network problem. She'll be joining in very
Then you
soon.
don't need to write your working.
Okay.
Can you hear me?
Yes.
Yes, we can hear
Yeah.
you.
Oh, sorry. So I was the one frozen.
Yeah.
um, okay, sorry about that. I'm back up now. Does anybody have any questions? Um, does anybody have any questions? I'm happy to let you speak.
Yes, there's one person that has a question on the chat on.
Okay. Please go ahead and ask your question. Eguche.
Okay.
O.S. Eguche.
Okay, thank you. Can you hear me?
Yes, I can hear you.
Okay, thank you, Dr. Saratu, for this presentation. It is quite insightful. And then many thanks to Dr. Anuya for the comprehensive conversation. Very interesting. Actually, I was hoping that the conversation will be around the applications of AI in public health, but it is exciting to know that you have taken it beyond public health and then extended it to other areas that AI is actually gaining applications. One thing you also mentioned that I want to give a question, a comment, or rather a question is data set when you were talking,
Yeah.
because I understand that the performance of any AI tool is directly proportional to the quality of the data set that was utilized in training it. So
Yes.
from the work you have done so far, from the systematic review you referenced, and then other studies you have done, what is your position about where we are in the global south, and then particularly in Nigeria, in having access to quality data set that we can use to build AI solutions that fit our own peculiar problems? Sometimes ago, I was exposed to a work a team was doing, which involved collection of data at the local level. And it was quite discouraging to know that if any research work was to be carried out based on that data set, then the result would be totally far from the reality on ground. So if we don't have this data set available in building AI solutions, then how do we maximize the potentials of artificial intelligence within our own context? And it is also not very encouraging to see that much conversations are not really growing in line with that challenge of generating quality data sets that we can use to build AI solutions that fit our own peculiar problem. Thank you.
Yeah. Thank you very much, Eguche, for that question. You are right. Like, we need, it's one thing, like we need data sets, right? That we are when it comes to the global south, like even if when we think about like Nigeria, we don't have we would love to see more data. I know there have been latest studies, like people working to create like data sets for, like, I know like it's very popular, the Yoruba language, to train like NLP models. You know, so we need, you're right that like, how can we, the interesting problem here is how can we develop like high quality data sets that can be used in mainstream algorithms. Like, we want to see our data sets being used. Like, when you come on and you see when you read like academic articles, you want to see high quality data sets like from Nigeria that people are using to like train and evaluate the model. So it's very important for us to collaborate, like to work with people, to work with like work hand in hand with people in Nigeria, like to create and evaluate those data sets. But it really boils down to us having improved, like increasing the number of AI researchers, like seeing an increase in the number of AI researchers researching our with researching our own local problems. Collaborating, one thing that my work really encourages is working with people that would be impacted by the technology that you would design. We need community. We want to see an increase in community-based participatory research approaches, where like we collaborate with communities in places, in regions in like Nigeria, local regions, collaborate with people, extract data sets, see how we can, like, we also need expertise to like evaluate those data sets to make sure that they are high quality, and then use those data sets in like training like AI algorithms. It all boils down to all of us. Like, we need collaborations, we need increase in people working on these problems. Yeah, so yeah, it is possible. We just need more collaborations. We need more people, more of us like researching, and then researching local problems that will lead to like natural, that will naturally lead to us like identifying the kind of data sets that we want to build, and like we working to build and evaluate those data sets.
But I also want to add to what Dr. Anuya just said, that sometimes one of the challenges as well, like, I mean, it's not that there's no data if I'm thinking about Nigeria, like we have NDHS, for example, we have, and NDHS, the Nigerian Demographic Healthcare Survey that collects data, I believe, on every 2 years basis. And hospitals, I think, more than any other arena of our society, I actually would argue that public health, that healthcare actually has data. The issue is access to the data. I would actually argue that if we're talking about any other arena, I used to work in agriculture, so I know that if we're trying to get agricultural data, that's quite difficult on a subnational basis, because various ministries are not collecting that data. But hospitals collect data. Primary PHCs, tertiary institutions, they collect data. The data is there. The issue is, what are the solutions? What are the innovations what are the problems that we've identified? Are we identifying problems? And are we collectively trying to innovate around those challenges? So I would argue that it's not really about, oh, we don't have data. We do, particularly where healthcare is concerned. I actually think healthcare is like the one arena that you can actually say the data exists. There are very few arenas in Nigeria, I would say, that one might say it doesn't that the data exists. And healthcare is actually one of the few places I would say the data actually exists. There's a question of access, and there's a question of what do you want to do with the data, and there's a question of what solutions are you trying to innovate around using that data. I think that is more like it, personally.
What about ethical considerations? Like,
exactly.
Yeah, when you want to get certain data, like what what do we have in place to make sure that like you're going to use, are there some regulations in place to make sure that like you're using the data ethically? Do we have people that do we have regulations around that? And you know, even when it comes to health information, it is a very sensitive domain. It is very, very sensitive. Even when you're thinking about health data, like even in the global north, right? Like, and that's why we have bodies in place to like make sure that you know, make sure that you're using the data ethically. Do we have
100%.
those? Yeah, do we have
Mhm,
those in place in Nigeria? So there are so many factors that go into this, like being able to use publicly available data, like
Exactly. Exactly.
for
Because
research.
even though there is, like, for example, there are policies around, like Nigeria has an NDPR, the Nigerian Data Protection Regulation. But if we're talking about the implementation of the NDPR, that's a separate issue entirely. There was a story that went viral the other day. We're talking about someone whose passport information, whose form, the form to fill out passports was found outside of the passport agency. You know, so like these are things that, and if a government agency itself is not respecting the NDPR, then, that leaves room for all kinds of abuse with regards to access to data. And so like, like we do have, in Nigeria, we tend to have a lot of things on paper, but then the implementation becomes another issue entirely. And that's definitely something else that needs to be, that needs to be addressed. That those are some of the, you can say, infrastructure that allow for technological innovation to thrive.
Yeah, absolutely.
Does anybody
Yeah.
else have any questions? We can probably take a couple more before we all have to go. Does anybody else have any questions? Anybody else wants to raise their hands, or anybody else want to put questions in the chat?
Yeah, and if anyone has any question after this webinar, like feel free. You can reach out on LinkedIn. If maybe something comes to mind after this, I'll be more than happy to answer questions that you have later.
Exactly. Thank you. And of course, you can also reach me. I'm going to put my email in the chat box. And I'll also share my email along with when I'm sending. I trust everybody here obviously registered for this webinar. So the emails, when we send out the recording of this webinar, I'll also include my contact information as well if anyone's interested. I think that might be it, Dr. Anuya. I think we might be done, seeing as everybody's being shy and doesn't want to see anything. Thank you so very much for joining us and for such an illuminating conversation, Dr. Anuya.
Yes, thank you for having me.
All right, thank you so much.
Yeah.
And thank you so much for joining us, everybody, from all over Nigeria and from all over Africa. Really appreciate all your time. You will get a recording of this. Please do share the recording of this webinar to everyone in your networks. And until next time, thank you so much. Have a good rest of your day, everybody.
Bye.
Bye-bye.